have health insurance, they say, what do I care? Well, you should care for that reason, as well as you might feel that it's important for people to have health insurance separate and apart from the impact on you. But let's just give you some statistics, and then I'm going to introduce our other speakers. Medicaid now covers more than 30% of births in New Jersey and provides health care to cover 800,000 children. Um, Medicare also pays 60% of the cost of nursing home care. So if someone goes to a nursing home for the first month, it might be covered by Medicare. But then after that, and most people stay in a nursing home like at least a year, it's covered by Medicaid. So most of the cost of nursing home care comes under Medicaid. And then, of course, people with disabilities, almost everybody that has some kind of a disability gets some benefit from Medicaid, either because it pays for the health insurance or it pays for some other kinds, group homes or other things that keep them from having to be institutionalized so they can stay in the community. But the biggest concern right now, or like we're hearing, are the hospitals. Because as I said, if the hospitals don't get paid by Medicaid, a lot of them will close. But what we're more likely to see is that whether it's a nursing home or it's a hospital or it's a community health center, that if they don't close, which they could, then the level of services declines. So when we were at the hearing last week and I was talking about nursing home care in our committee and how it would suffer because nursing homes would close, one of the Republicans members said, well, we'll just save money by getting rid of the nurse staffing ratio. We have a ratio that said you have to have so many nurses per patient in a nursing. They said, oh, we'll just get rid of that and that'll save, $25 billion. And I said, well, first of all, that's only saving $25 billion and you need 880. But I said, beyond that, what does that mean? Okay, the nursing home stays open, but there's no nurse, nobody to take care of the patients. I mean, in other words, this is the problem. It's either a question of these facilities like hospitals, nursing homes closing or having less care, and what's the consequence of that? I mean, we know that, we already worry about the level of nursing home care right now. And it's a lot better than it used to be. Believe me, 20, 30 years ago, it's much improved, but it could easily go downhill if they don't get reimbursed. Also, doctors take Medicaid. If Medicaid is not available, they may just say, well, I'm not taking you because you don't have Medicaid, you don't have health insurance, I don't have to take you. I mean, the list goes on. But anyway, I just want to end my remarks before I introduce these ladies is that, I really think that healthcare, it shouldn't just be a privilege for the wealthy. It really should be a right for everyone. But even if you don't believe that as a value, understand that it's going to impact you because of the additional cost. No family should also go bankrupt. We hear a lot about medical debt. One of the things that people can do is to go into debt to pay for the health care if they don't have health insurance. And that's not a good thing. And I don't think it's a good thing for parents to have to choose between, medication or paying for food. What I would really like to see is to strengthen Medicaid and strengthen Medicare and strengthen Social Security. So I'm going to keep fighting to make sure these cuts in Medicaid don't take place. But I can't do it alone. I've got 4 women here who are very strong and going to talk about Medicaid, but we also want our larger audience of constituents to be out there talking to your friends and relatives about why we should be cutting Medicaid. But let me start with Maura Collingscrew, who is from New Jersey Citizen Action, to share her perspective on this. Maura, if you will.
Thanks, Congressman Pallone, and thank you for doing this and for my colleagues and all the people who've joined us tonight. This is a critical battle, and there is a lot of misinformation out there. So really happy to join this so people can really understand what's at stake. Just to add to what Congressman Pallone has already put out there, in New Jersey, as he said, there's nearly 2 million people on Medicaid. That's 4 in 7 seniors living in nursing homes. It's 1 in 3 of our children in this state. It's 1 in 3 people who live with disabilities. and it's 1 in 7 of our working adults. So basically, everyone on this call has either touched that system themselves or knows someone in your family or neighborhood who is dependent upon this service. So it's something we all really need to care about. What I want to focus on is what the implications are for Medicaid, but also for the state of New Jersey. The Department of Human Services here in New Jersey did an impact analysis of what the potential cuts could be. Medicaid is a $24 billion program in the state of New Jersey. 14 billion of that comes from federal funds. The other 10 billion comes from New Jersey state budget and our own revenue sources. The estimate from the Department of Human Services is quite staggering. DHS estimates that the cuts, dependent upon what cuts are made, could range up to $5.2 billion. That is a staggering amount for our program. It would encompass 22% of all funds that we use to cover Medicaid. They also estimate that the cuts to hospitals, this is in addition to that $5.2 billion that would impact the program directly, is nearly $5 billion, $4.9 billion. That is the amount New Jersey hospitals could stand to lose. And cuts to hospitals in this district, in Congressional District 6, that Congressman Pallone represents, would range anywhere from $127 million next year to nearly $500 million. Just think about those numbers for a minute. There is no way the state of New Jersey or our taxpayers could make up for cuts of such staggering proportions. So this is a red alert moment. We are looking to cut a lifeline that helps people in our state, in our families, in our communities survive. It is the only lifeline millions of people here in New Jersey and across the country have to access our healthcare system. And as I like to say often, uninsured people are not free. If we go back to the days of skyrocketing uninsured rates, which is what we had before the Affordable Care Act and the expansion of Medicaid, we will all see our health insurance premiums skyrocket. They are already high. They are becoming more and more difficult for families to foot the bill as they look to survive and pay for housing and food and all the other things they need to pay for. This is not something the government can just pull out of and leave us holding the bag. It will cost people their lives, and we will be in a position of having to play a game of lifeboat because it will be the states themselves that will have to decide who is on the program and who is off. And I, for one, do not want any part in trying to decide if it's a grandmother or a child or someone with disabilities or my poor neighbor who needs to be off this program. This is not where we need to be, and it is not something we even need to do if we simply continue and ensure that wealthy corporations and the ultra-rich billionaires in our society pay their fair share of taxes. So I'm going to leave it there and turn it back over to you, Congressman Pallone.
Thank you, Maureen. I want to get to questions, so I don't want to comment on everything all of our speakers say, but I do want to point out, I guess I should have said that Medicaid is partially paid by the state and partially paid by the federal government. The basic Medicaid is 50% paid by the federal government. Expanded Medicaid is 90% paid for by the federal government. And so what Moore is trying to say is that the federal government reduces those amounts in any way, the state cannot make up the difference. In other words, we estimate that over the 10 years of this budget bill, there'd be about 9 to 10 billion in cuts to the state of New Jersey. And that's about a billion a year, and the governor and the legislature just don't have the money to do it. So they're just going to have to either say more people are not eligible at all or reduce services. And that's the problem that we face. So thank you, Maura. Next is Lauren Zalepka, who's from the ARC of New Jersey. And she's going to talk about the disability community and how they're impacted. She was my guest at President Trump's joint address to Congress a couple of weeks ago. And she's been great in getting out the word about how bad these Medicaid cuts would be. So let me go to Lauren next. Thank you, Lauren.
Thank you so much, Congressman. Good evening, everybody. I so appreciate the opportunity to be here tonight and share my story about Medicaid and why it's so critical to my family and many families like mine. My daughter, Danny, is 33 years old, and she has an intellectual and developmental disability. She's a strong young woman and an active member of her community. She has a vibrant life and grows more independent every day. She enjoys time with her friends. She participates in recreation activities through the Arc of Monmouth. She takes art classes. She loves to volunteer her time. Medicaid is the only reason all of that is possible. Without the supports and services provided by Medicaid, the life we have helped her build would disappear. The importance of Medicaid to Danny and her friends cannot be overstated. It funds everything from therapies to transportation, support professionals, group homes. It's what allows my daughter to live her life to the fullest, but it's more than that. Through home and community-based services, Medicaid provides vital support and assistance, and it's designed to help individuals assimilate in the community and do so safely. As a mother, it is absolutely horrifying to see statistics that show individuals with intellectual and developmental disabilities are more likely to be victims of crime and exploitation. My husband and I worry about Danny's safety. We worry about who's going to keep her safe when we're no longer able to do so. We worry about her friends who don't have family and rely on Medicaid now to keep them safe. If we reduce what Medicaid offers, if we defund it or take it apart, who will be there for Danny and her friends? They don't deserve to be in institutions. They belong in their community. They deserve more than that. They deserve a full life, the support to navigate their own path, and the services that will help keep them safe. Currently, in New Jersey, there are thousands of individuals with intellectual and developmental disabilities on waiting lists for Medicaid-funded home and community-based services. There are thousands waiting. We cannot afford to lose one penny. We have a moral obligation to strengthen and protect Medicaid, to ensure that every person with intellectual and developmental disabilities, like my daughter, have access to the support that they need to live, work, and thrive in our community. Inclusive communities foster empathy, patience, creativity, social cohesion. Danny deserves to be part of a community like that. And truthfully, our communities need more people like Danny. Medicaid must be recognized as the critical lifeline it is for my family and so many families in New Jersey and across the country. Thank you again, Congressman Pallone, for your tireless fight for Medicaid.
Thank you, Lauren. I'm just going to go on to Rachel because I don't want to run out of time for questions. So Rachel Peace, who's going to talk about how these Medicaid cuts will impact her family.
Hello, everyone, and thank you again, Congressman Pallone, for everything that you're doing to try to save Medicaid and for having me tonight. So my name is Rachel Peace, and I was born and raised at the Jersey Shore, where I currently live with my 4-year-old son, Kason. I truly hope that by sharing our story, it will help to humanize rather than politicize saving Medicaid. A little over 2 years ago, Kason and I were living in an unbearable environment where I experienced and he witnessed domestic violence. When I reached my breaking point, we left with the clothes on our backs, a spare diaper, and my phone. I had no proof of income, no wallet, and no plan. Since then, I've been able to secure an order of protection, housing, and work through my small business. I've overcome PTSD, and thanks to Medicaid, I have access to ongoing weekly therapy and the medication I need for anxiety and ADHD. Medicaid has also enabled me to get Kason into play therapy. He needs this care because he was diagnosed with separation anxiety brought on by visits with his dad. It causes him gastrointestinal issues that have even sent him to the ER. Medicaid covered that visit, x-rays, follow-ups with his pediatrician, and visits to a pediatric gastroenterologist and a pediatric nutritionist. Without Medicaid, Kason and I would be left to cover the costs of treating our trauma, treatment that we need, out of pocket. It worries me that our government could rip away healthcare for its own people, including children and domestic violence survivors like us. And our story isn't unique. Millions of people who rely on Medicaid have endured far worse. We need to work together to protect everyone who relies on this critical healthcare program. Good health means Medicaid recipients can continue to work, continue to contribute to the economy, and continue to pay taxes that fund life-saving programs, including Medicaid. For the record, saving lives isn't a waste. Helping American children thrive isn't fraud. And from experience, providing access to healthcare for our most vulnerable is not abuse. We all know and love someone on Medicaid, so let's do something about it while we still can. So what can you do? Republican Congressman Tom Keene is the majority on the House Energy and Commerce Committee, which is the one in charge of making these Medicaid cuts, as Congressman Pallone already shared. So please, tell your friends and family who live in his district, District 7, or in the New Jersey districts represented by Congressman Smith and Van Drew, to reach out and demand they stop Medicaid cuts. Post on social media and tag them, email or call them, and my favorite, show up at their offices, which is how I connected with Congressman Pallone and his team. Remember, you have a right to a reply. Remember, you have a right to representation that works for you and the people you love. Remember, you voted your representatives in, and you can vote them out. There's been a lot of talk about the power of the purse, but we, the people, have the power of the vote. So mark your calendar for the November 3rd, 2026 midterms and vote out anyone callous enough to harm your community by approving these Medicaid cuts. You deserve better. We all do. Thank you on behalf of myself, my son Kason, and everyone else in New Jersey and across the nation who is counting on you and the people you know and love to get involved and save Medicaid.
Thank you, Rachel, and thank you for all that you've been doing to bring attention to why these Medicaid cuts would just really be awful. I'm just going to move now because I want to get to questions to Danielle Calhoun. And Danielle Calhoun, as you can see from her, I thought I saw it there, Danielle, you have the SEIU service employees. Is that, do I have it right?
You have it
Union
right,
that
Congressman.
she's a member of whenever I see the purple. But she's going to talk about the challenge that the elderly and workers will face if these cuts go through. The SEIU represents a lot of people that work in nursing homes, hospitals, and other places that are impacted by Medicaid cuts or would be. Hopefully they don't happen. Thank you, Danielle.
Thank you, Congressman. I appreciate that. So hello, good evening, everyone. My name is Danielle Calhoun, and I'm a cook and a dietary aide at the Laurel Bay Health and Rehabilitation Center here in Keensburg, right here in Congressional District 6. So you might wonder, what does a cook have to do or know anything about healthcare? Well, I can tell you firsthand that food is medicine. Every day, I prepare the meals that help our residents heal. Many of them are Medicaid recipients, and I've come to know and care deeply for them. In our district alone, nearly 200,000 people rely on Medicaid for their health care, including many of my residents and coworkers. Medicaid keeps our community healthy, supports our working families, and protects seniors and people with disabilities. But right now, Medicaid is under attack. And if these proposed cuts go through, residents will lose care, facilities will struggle to stay open, and frontline workers like myself will be left to deal with the devastating consequences. So instead of cutting Medicaid, we need to expand it to ensure everyone gets the care they deserve. So that is why I proudly stand with Congressman Pallone and saying, hands off our Medicaid, protect our health care, and let us save lives. Thank you, Congressman, and everyone else.
Thank you, Danielle, and thank you to the SEIU for all they're doing to, raise attention to these potential Republican Medicaid cuts. And let me thank all three women for being here today. I'm now going to go to back to Liam, Liam Fitzsimmons, who's my chief of staff, and he's going to monitor questions that we're going to get hopefully from constituents. I hope we get some, Liam. I know we have a lot of people on.
We already have some. That was a really powerful presentation. Thanks to the guest speakers and to you, Congressman. Let's just as a reminder, if you want to ask a question, press the Q&A button. Type out your question. Let us know your name if that's not listed in your profile. And where you're coming from in New Jersey, and we'll get your question in the queue. Let's start with a three-part question from Chris Miller. Chris, Congressman is asking you to please explain how the $880 billion instruction cannot be found in your committee without touching Medicaid. That's part one. Part two, what are you doing to work with Republicans in New Jersey to make sure they vote no on the proposed cuts? And part three, how does the federal match work with the state, and how impactful is that on Medicaid services in New Jersey?
All right, I didn't write it down, so I'm going to try to remember. First of all, the way it works is this budget resolution, and I'm trying not to be too bureaucratic, which was adopted a few weeks ago now, instructs various committees to either raise money or cut taxes or cut money. In my committee, it's totally a cut, right? So in other words, it says $880 billion has to be cut within the bills or the functions that we have in our committee. I call it the jurisdiction. And then they've said you need another 500 billion in cuts across the board. So when I say could be $1 trillion or likely will be $1 trillion, it's because that other 500 could be allocated also to the committees, including mine. So our committees, the bills that come before our committee, the majority of the bills in the House, right? It includes healthcare, energy, consumer issues, environmental issues, the internet, right? But a lot of those don't involve any funding, right? So what the Congressional Budget Office said is, okay, what can you cut within your committee's jurisdiction, which is, what we call mandatory funding, meaning it's not like year-to-year funding, right? Because remember, this is over 10 years, right? And they basically came back and said, well, you could maybe get rid of the rebate program to help homeowners pay for their, electric bills in certain circumstances, or help them to get money for, like we have programs where you get help paying if you put solar panels on your roof, right? But all those things only add up at the most, if you take every one of those, to $135 billion. And that would be cutting everything that comes under those other functions, right? All the rebates, everything for homeowners, whatever, LIHEAP programs to help people pay their electric bills, EV, if you buy an EV, you get a certain amount of rebate. If you did all that, it's 135 billion out of that 880, which, as I says, is probably going to really be $1 trillion, right? So you're talking that 90% of this essentially has to come from Medicaid. And believe me, the committee is not going to, the Republicans are not going to want to eliminate that 135, because some of those things, are important to them. So we're really talking about Medicaid, right? That's what we're talking. Now that also was, we also have jurisdiction over Medicare, but, which of course, the president and everybody doesn't want to touch, because, they know if they cut Medicare, I mean, you can imagine the uproar over that, right? So they've said it's got to be Medicaid if it's not Medicare. I mean, that's the answer to the first question. Second question was about reaching out to Republicans. You know, I don't know if reaching out is the word, because to be honest, it's hard to reach out to them. What I've done is to say, please don't vote for this, because the framework, which was adopted in the budget resolution, says we have to cut the 880 billion plus, now goes to the committee to make the cuts, and we haven't done that yet. But we know from what I just told you that that's where the cuts are going to be. So what I've been asking them, or kind of demanding, to be honest, is that they do not support that. Now, what can happen? Well, they can go back and say this budget resolution should not cut Medicaid, and so we want to change it. That's the only alternative that there is. They have to vote no. They'd have to say, no, we're not doing this, and demand that they go back to the drawing board. Now, you know, one of the problems with all this is it's paying for tax breaks for wealth, for, you know, billionaires, very wealthy individuals, and for large corporate interests. Well, do they really need a tax cut? No, they don't. If you were going to do any kind of tax cut, it should be for the little guy, right? So they'd have to say, no, we're not going to cut Medicaid in order to pay for this. We don't need this. You know, the big corporations and the billionaires don't need this tax cut. And that's number two. Now, what was the third one? Was about what was the third part of the question, Liam?
The third part was Chris was asking you to explain how the federal match works. And
Oh, the
impact
federal
it
match.
has on
So it
Medicaid
depends.
services.
For regular Medicare, meaning people that, you know, I'm just coming up with these figures. I don't have them in front of me, Chris. But traditionally, Medicare would, you know, for your health insurance part of it, right? For those who get their health insurance from Medicaid, Medicaid pays a lot of other things that, you know, other than just health insurance for low-income people. You know, we talked about nursing homes and disability and other things. But let's talk about that. So for the people that get Medicaid for their health insurance or basic health insurance, they have to be at a fairly low income. I think for, like, you know, I'm just making it up, but let's say that it's, you know, 25,000 or so for a family of four, right? You know, most of these people work, right? But they don't get health insurance on the job, right? They can buy Obamacare or Affordable Care Act and get subsidized, but these are the very low income, right? So for that in New Jersey, the federal government pays 50%. In some states that don't have as high a per capita income, like Mississippi, it's 70%, right? But what we did in the Affordable Care Act is we increased that income level to maybe another 10,000 higher. So if it was 25, it went to 35. I'm making these numbers up because I don't have it in front of me, but we extended it to a little higher, right? And that brought in another 700,000 people in New Jersey that wouldn't have had health insurance under regular Medicaid. For that, we pay 90%. And there are 9 states that have these triggers that say if we were not New Jersey, if we get rid of that 90%, only pay 80%, they will take all those people off Medicare. So let's say that for the regular Medicare, the federal government reduces it from 50 to 30 or 40, or for expanded Medicaid, they reduce it from 90 to 80 or 70, right? That's how you get to that. What the governor says is, you know, 9 to 10 billion or $1 billion per year in cuts because it's a 10-year program. Well, then that's the problem. Now, where's the state make that up? They don't have it. They're not going to raise taxes, right? Because everybody's already hurting. And so they just take the people off. You're not eligible anymore because your income, you know, we can't afford it. Or they reduce services. So the reimbursement rate for hospitals or nursing homes gets to be less. And then they reduce services. Some of them are nursing homes and hospitals are operating at such a, you know, almost at a deficit. So if you reduce their reimbursement, they may close, or they'll close a wing, or they'll reduce services, or as one of the Republicans said the other day, we'll just get rid of the nurse staffing ratio so we won't have any nurses at night or after 5 o'clock. You know, this is the kind of thing. I know I went on, but you asked 3 questions, Chris, so I had to.
That's right. That's right. We have a few guests who didn't leave their names, but I think one of them in particular asked, a question that so many people have been asking when they call into the congressman's office, and it's how can we be effective in registering our opposition to these policies? And what will work now, especially in this environment. So, Congressman, would you weigh in? And I think it would also be good for you to turn it over to Lauren to maybe share her experience of how she's been organizing within her community and her daughter's community, and maybe share a little bit, Lauren, about how you got involved with our office as well.
Well, I'll say quickly and then I'll turn it over to Lauren. I still believe that the president, the Congress responds to public opinion. I mean, some people have say, oh, why do you say that? They don't care. But I still think that they do, either because, as Rachel said, they may worry about running again, or because they just, care and don't want people to not have health insurance for all the negative consequences that I talked about today and that the other four women talked about. And so, the immediate thing is if you're in a district where we have these three Republicans, you call them up or you contact them and say, please don't do this. And don't give me this nonsense about how you're really not doing it. You're going to, fudge this somehow because we know that this is what the Republican leadership is talking about and you can't listen to them. So that's one. If you're not, if you're not in one of their districts, then, it's just a question of public opinion. You tell your friends, you start raising this issue so that it becomes, so it goes on social media, you go on Twitter or other types of social media and you write letters to the editor. The whole idea is to bring attention to the public that these cuts are detrimental and that they really are likely to happen. Because once they happen, that's it, right? I mean, we just don't want this to happen. We don't want these votes to take place. But let me turn it over to Lauren.
Thank you, Congressman. Yeah, I really think it's about getting the word out and taking the opportunities. And I'm so grateful that the Congressman gave me an opportunity to speak at a press conference and then to go to Washington with him. And since then, I've talked nonstop about my experience and connected with as many people as I could. And now we're putting together things like letter writing campaigns. So we had about 200 people virtually and 60 people physically in a building, like gave them stamps and envelopes, write the letter now, we'll mail it for you, to make sure that not only does the word get out, the phone call, the email, but also a good old fashioned paper letter so it hits everybody's desk and they know. And as we're having these discussions, I'm finding that people are saying things like, I didn't know Medicaid paid for Danny's programs. I didn't know that's what Medicaid did. So it's an opportunity to educate them as well. And so I've been very active with ARC of Monmouth, ARC of New Jersey. We're making this such a priority. And through discussing this advocacy, we realized, you know what, just like Danielle explained, there are so many essential support workers who care for people with disabilities in our group homes and our day programs. They're going to lose their jobs. So obviously, as a mom, I'm focused on services for my daughter. But now we're going to loop in the direct support professionals to say, hey, help us. They have big voices. And so the more people we can get to rally around this cause and get the word out, the better.
Thank you, Lauren. I'm sure we have more questions. Actually, I'm not sure, but hopefully.
There are a ton more questions. They're flowing in, so we appreciate it. We're going to try our best to get to everybody. We have a couple of questions about nursing homes, asking what is the impact on nursing homes, and in particular, we had a constituent asking about a planner that works at a nursing home where one of their family members lives, and so they're wondering, are those jobs at risk? Are nursing homes at risk? Congressman, you want to speak to that?
Yeah, and I have to try to be brief because believe me, I could talk for hours about this, right? Because I don't like the way we finance nursing home care at all. But the way the law is now, if you go to a nursing home, essentially for the first month, it's covered by Medicare, right? Medicare, not Medicaid. But after that month, it's no longer covered by Medicare. And and what they do is they ask you to what we call spend down. So if you have assets, they won't take your home, at least while you're still alive, right? but they will take any other assets you have. So if you have Social Security or you have a pension or you have property, they will insist that you what we call spend down, which means that you have to pay the price of the nursing home care until you have no money left, essentially. It's a terrible situation. I don't, I've over the years tried to change it. I think Medicare should cover nursing home care, which is, Medicare is not income based per se, but that's not the law, right? And people don't know this. They think Medicare covers it. It does not, right? And most people stay in a nursing home for like average on a year, I think, Danielle, correct me if I'm wrong. So you're spending that first month on Medicare, and then the rest of those 11 months, you're spending now whatever money you have. And then when you have almost no money left, then you go on Medicaid. But a lot of people don't have anything, so they go on Medicaid almost immediately, right? And that's what pays for nursing home care. Now, what, a lot of these nursing homes, I mean, look, I have to be honest. I remember, I know I'm talking too long, but I remember in the 70s, because I've been around a long time, when we had fires at nursing homes, Danielle, they were awful places, so many of them, right? And we did a lot in the state legislature, because I was in the state legislature before I was in Congress, to try to improve the quality of care and safety measures and health measures. So nursing homes today are a lot better than they were, 20, 30, 40 years ago. But but part of that was a higher reimbursement rate for Medicaid, right? So if you lower the reimbursement rate and say, okay, we're not going to have, we've only had this nursing home staff requirement at the federal level for, I think, a year or so, right? But the state has had it, I believe, where they say, so many nurses, so many healthcare workers have to be for the number of patients, right? And so that means, I believe, that like it's 24 hours, right? If you start cutting that back, and you could have a nurse, there'd be no nurse at all there after 5 o'clock, or they would not, they cut back on the safety of the nursing home. I mean, I don't want to say we're going to go back to the fires again, but we could. And so a lot of them are marginal. They would just close, or because, some nursing home operators, I don't want to operate this nursing home where I can't care for people, right? And so they'll either close or they'll have a lot less services. And meaning they, of course, fire a lot of people. So that's going to affect the number of people that work there. But with less people, less care, and it's less safe.
Thanks, Congressman. Danielle, did you want to hop in on the nursing home impact?
Congressman is exactly right. It's terrifying what may come to them. And the breakdown is exactly right. People have lost their whole life savings, just trying to keep up with the care that they absolutely need. And then, just like he said, if the jobs are gone, guess what? Then we're going to need the Medicaid too. And it just goes on and on, that trickle effect. The congressman was exactly right. Exactly right.
Thanks, Danielle.
Thank you.
We have a couple of questions, a couple of similar questions I wanted to kick over to Maura. Maura is an expert across all issues of healthcare. And so can you help people understand the difference between these proposed cuts to Medicaid and the ACA and Obamacare? We have a couple of people asking, will this effort impact Obamacare or the ACA? Can you help clarify for folks?
Yeah, so under the Affordable Care Act, Obamacare, as people refer to it, we expanded the Medicaid program. Medicaid did not cover low-income working adults for the most part. There were some rare exceptions to that before the Affordable Care Act. And states had the opportunity to pick up the expanded Medicaid program. And that program, as Congressman Pallone said a few minutes ago, 90% of the cost of that program is paid by the federal government. In New Jersey, we have nearly 700,000 low-income working adults in that program. So if the program in Medicaid is cut back, people would have the option to go to the Affordable Care Act. And here in New Jersey, we run our own state marketplace where people go and sign up, and people can get subsidies to help pay the cost of premiums. But I will tell you, there is a huge chasm between Medicaid, which is a no out-of-pocket program for enrollees, to the Affordable Care Act. People who are making minimum wage here in New Jersey, which is right now over $15 an hour, could not afford those programs because while they get coverage, most of the programs have out-of-pocket expenses that low-income people could not manage. The other thing that could also be cut are things like our children's health insurance program. Many of the people, adults who sign up for coverage under the Affordable Care Act, their children qualify for our children's health insurance program. So their parents could be in an Affordable Care Act plan. The children are in the Children's Health Insurance Program, and 65% of the cost of that program is paid for by the federal government. So it would have a huge ripple effect across both programs, and not one I think would be sustainable for families losing coverage.
And Maura, just to give you an example, without mentioning names or places, I was at the grocery store in Long Branch where I go to, regularly. And I was talking to a woman there who said that she couldn't afford, she works at the grocery store. She's I don't know if she works at the checkout counter or she loads the shelves, whatever she does, right? She's working hard. It was like 9, 10 o'clock at night, right? And, she said she can't afford the, whatever, even with the subsidy on the Affordable Care Act. And then she was on Medicaid and she was worried about, what would happen if she's not eligible for Medicaid because she can't afford to pay even with the subsidy. Now, the subsidy is pretty high. I mean, many people are only paying $100 a month, right? And so I might say, gee, $100 a month subsidy, that's, I only got to pay $100 a month, right? But that's $1,200 a year. And I don't know what they, pay at the local grocery store, but they don't provide any, in this case, they don't provide health coverage. $1,200 a year is, maybe to me doesn't seem like a lot, but for her, it made it a difference if she couldn't do it.
Congressman, we have a question from a constituent asking about waste, fraud, and abuse. Aren't these cuts over 10 years and aren't they focused on waste, fraud, and abuse? Aren't they a relatively small percentage of the Medicaid budget?
No, and please, that's such a good question because this is what my Republican colleagues say. Oh, we're just going to cut waste, fraud, and abuse. But understand that's not what they're doing. If you want to cut waste, fraud, and abuse, you set up an inquiry, an investigation, and you look at where the waste, fraud, and abuse is, and then if somebody's getting Medicaid or some and shouldn't be, then you cut them off, right? But that's not what's being talked about here. What they're talking about is cutting the percentages that we already discussed. So 90% for expanded Medicaid comes to the federal government, they reduce it to 80 or 70 across the board. That doesn't get rid of waste, fraud, and abuse. Or if you have regular Medicaid and it's 50% federal covered, you reduce that to 40 or 30%. That doesn't get rid of waste, fraud, and abuse, right? You're just talking about across the board cuts, right? Now, just so you know, there was one state, Georgia, that actually did put in place work requirements, in the last few years. I don't know if it still exists, and they did it for a few years. And what they did is they ended up spending all this money processing all this paperwork to try to get people. You know how when you go to unemployment, you have to report, that you went to look for a job, and it's legitimate because it's unemployment, right? But in the case of Medicaid, if you institute that, right, first of all, most of the people that get Medicaid are either working or they're disabled or whatever. So if you maybe force them to, file these papers every month, what happened in Georgia is they found out that almost everybody who they were sending the paperwork to either didn't file it because, it was a lot of work. They couldn't figure out what to do, or they were already working. right? So it didn't actually result in any more people going to work because most of the people were already working unless they had some kind of disability. Now, are there going to be some people? I don't know. I think they had a few thousand or so that, maybe, they found, could work. But most of the people just got kicked off because they didn't file the paperwork and, just lost their Medicaid coverage. I mean, this is not, this is a Medicaid really, for the most part, is people who are working. So you're not going to employ more people by putting this in place. And the Georgia experiment shows that that's the case.
Thanks,
Liam,
Congressman.
could I jump in about the work
Of
requirement?
course.
Thank you. In managing my daughter's benefits, I consider it my part-time job. It's unpaid. And it's stressful because we're constantly afraid we're going to miss a deadline, get it wrong, and she's going to get kicked off. And I don't think we get anything that's less than like 10 pages at a time. It's very intimidating. And, I'm actually an attorney in my other life when I'm not a mom. So paperwork isn't hard for me. But if you're somebody with an intellectual or developmental disability managing your own benefits, or if you have a child with, God forbid, significant medical issues who's in and out of the hospital, the task of having to do that kind of paperwork is, I think, designed to kick people off who deserve the benefits, but just aren't going to be able to jump through the hoops. That's my opinion.
That's exactly our experience and and exactly what we saw in Georgia. So I'm glad you brought that personal experience to bear. We have a question, Congressman, from Karen Brady, who's asking, can we get dollar estimates of how much this will affect non-Medicaid residents of New Jersey? And she's also asking, is Medicare next on the chopping block? So estimates of how much this proposal would affect non-Medicaid residents of New Jersey, and what does this mean for Medicare? Is that next?
Well, in the committee, we haven't had a formal hearing or markup on this yet. And I think part of the reason, and this is another thing, of course, in our case, we have 2 Democratic senators, so that's why I really haven't mentioned it. But the Senate has not adopted this House budget resolution that has, this $880 billion in cuts. So one option is that, the Senate just doesn't adopt it and that's the end of it. But I mean, we're all in New Jersey, so I'm not asking you to contact your senators because they're all on board with us on this. But even in our committee, and sometimes I wonder if they're just mixing Medicare and Medicaid. Some of the members, when talking about this publicly, have said, well, we can cut Medicare and Medicaid, or they just say we can cut Medicare. Now, I assume that they're confusing the two because I can't imagine that any politician really would articulate that he's going to cut Medicare, but you never know. Maybe there's some that do. So we have jurisdiction over Medicare, and these, we could reach, they could reach some of this money by cutting Medicare. I don't think that's likely. And so that's why I'm not asking anybody to write about Medicare, because I think they'll all write back to you and say, oh, we're not cutting Medicare. You've got to talk about Medicaid. But one of the consequences, of course, I don't know if this is what you're getting at, Karen, but when we say that like we were at Children's Specialized Hospital, I think Lauren, I think all of you, well, maybe Danielle, were you there that day? No, Daniel, was somebody else. But I think at least the other 3 were there. This is part of RWJ Barnabas in New Brunswick. They have a Children's Specialized Hospital. And we estimated that the cuts to Children's Specialized Hospital, I don't know, it was 36 or 46 billion. It was something like that, right? If this was done with the Medicaid cuts. And, what do they do, right? So they're not getting this money from Medicaid, and, they rely on private insurance, ACA, Medicaid, Medicare, probably not so much Medicare at Children's Specialized Hospital, but it's mostly Medicaid. But, what do they do? Well, they can't run a deficit, right? Because they'll have to close, right? So what do? They're going to have to raise insurance rates on the people that have insurance, whether it's private insurance or it's Medicare or it's the ACA. They just have to, charge more, which means the rates go up. And that means that everyone else, whether you're on Medicare, ACA, or private insurance, is going to pay more. Or alternatively, those insurance companies increase copays. And so you pay more of a copay. And copays are going up. I mean, I don't know how many of you, who people are watching have been to the hospital lately, but copays are going up. Insurance rates are going through the roof. These are the consequences.
Absolutely. And the number, Congressman, we just double checked, it's $49 million.
49, okay.
That
Yeah.
is on the line for children specialized. So folks can imagine the impact that that could have on people who use the hospital. But just imagine if your local hospital closed down as well, right?
And there
The
are
type
some
of,
that are very borderline and
Yeah.
will close. I mean, I'm telling you, because we've talked to them. I was on the phone with the New Jersey Hospital Association today.
One of the things that
Liam,
our
if I
office.
could,
No,
no,
I
Liam,
was gonna ask more if we could get Rachel just to comment, because
oh, yeah,
in our
absolutely.
experience, what we've been finding is there are lots of indirect impacts on people who aren't impacted by Medicaid, but there's a whole group of people who don't realize that what Medicaid does. And Rachel, I was hoping you would talk a little bit about perhaps your sister's experience, if you're comfortable in sharing that side of your family's journey and how the Medicaid program impacts you there.
Of course. So, beyond myself and my son and our lived experience, my older sister has severe mental illness. She has been in and out of institutions for over 25 years. She was diagnosed with bipolar at the age of 12, and then later on with schizoaffective disorder, which, if you're not familiar, schizophrenia, you see things, schizoaffective disorder, you hear things. So I'd be visiting her in behavioral health hospitals where she'd tell me, people were talking to her on the radio and she had died and come back to life. She has also attempted suicide over the course of those 25 years battling her mental illness. And the majority of her health care comes from Medicaid. She also has Medicare and disability, but as the congressman said, they're not going to be going after Medicare because they don't want to get that population of seniors to turn on them and not come out and vote for them, right? So I think that Medicaid does a lot that a lot of people aren't aware of, especially for the disabled community, as Lauren has been sharing. And my sister receives a lot of critical ongoing services from Medicaid. She was able to get treatment that kind of reset her brain. It's a little bit complicated, so I'm not going to get into the specific treatment, but she's been out of the hospital for almost 2 years thanks to that treatment that Medicaid paid for. And she also has ongoing antipsychotic medications that she takes, which, if any of you have ever dealt with anyone in your family or community who has mental illness, getting them to consistently take their medication is a real challenge. And so there are teams who come out and make sure that she's taking the right medications at the right times and adjusting doses when she starts to get manic or depressed or whatever, what have you. And so without those teams that also come out and ensure she's taking the right medications, I personally believe that she would die. And so it's not just working people like me. It's not just little kids. It's not just people with intellectual disabilities. It's not just the hospitals. It's not just the people working at nursing homes. It's people who literally will die, disabled people who rely on Medicaid that will be impacted by these cuts. And I think, as the congressman said, if none of this is tugging at your heartstrings, we don't have to agree on values about people deserving a right to health care, but you're going to pay more. Your private insurance is going to go up when all of these people who come off of the Medicaid system are going in for uncompensated care at hospitals and emergency rooms, or getting onto the Affordable Care Program and then not being able to pay their copays, not going to the doctors, and then ending up in emergency rooms because they can't afford care. Like, this just touches every single facet of society. Like, we literally have a government and we literally pay taxes in order to be taken care of. And yet all of these representatives are trying to give cuts to billionaires and major corporations. It doesn't make any sense. And people should be outraged, whether it's from a moral perspective or it's from a financial perspective, because everyone will be impacted. And so that's why I'm so passionate about this. And I'm hoping that the stories that I'm sharing about my family reach someone and get them to think about this from a different perspective.
Thanks, Rachel. Maura, did you want to comment?
Just briefly, I wanted to add that tomorrow, New Jersey legislature starts their budget hearings. We're entering budget season, and New Jersey, by the end of June, has to adopt a budget. If New Jersey loses billions of dollars in federal funding, we all make up that difference. And if we don't make up the difference, that means less money for our pension payments, less money for our schools, less money for our property tax programs, less money for our seniors. So we will all feel it. Money just doesn't come. We have to fill the gap. And here in New Jersey, it's really going to be painful if the federal government institutes these cuts.
Thanks. We had a comment from a constituent who just said, was kind of asking as a comment, why are we calling these programs entitlements? Let's call them safety net programs. So I wanted to pass that along. Congressman, jumping off from what Maura commented on, we have a constituent who's asking, aren't there other states more adversely impacted than New Jersey? Will the Republicans in those states see an impact to their constituents? Won't they feel the effects of the pain these cuts cause? And a comment on your Republican colleagues throughout the country and how you think they're looking at this?
Well, there's no question that certain states will suffer more than New Jersey, but I don't want to take away from the suffering here. But, many of the states, their federal match, like Mississippi, is probably the worst example, right? The match is based, the basic Medicare match is based on the, I guess the how much people make or what their incomes are. So in Mississippi, which I believe is the state with the lowest per capita income, the federal government pays 70%. Now, with the Medicare expansion, it's 90% for every state, right? And there's I think 9 or 10 states that have triggers. So they say that if you reduce the the Medicaid expansion that the federal government pays from 90% and you reduce it to say 80 or 85, and the Republicans are talking about more than that, automatically those states will not have Medicaid expansion anymore. And I think there's 9 or 10. So automatically you'd have millions of people in the other states that would just lose Medicaid outright. But even for the basic Medicaid, if the federal government pays 50% in New Jersey, but it pays 70% in Mississippi. So, if you go down, like say you decide we're going to just give you 40%, right? Well, then a state like Mississippi would even have even a bigger problem because they get 70%. But the other problem too is that in many of these more rural states, the hospitals are barely surviving, right? And so a lot of rural hospitals would close. So yes, you do see Republicans in those other states concerned in the same way that hopefully our Republicans in New Jersey are concerned. And some of them are saying, well, I won't cut Medicaid. But the proof is in the pudding. Let's see what happens, right? So far, this hasn't happened, and we're trying to prevent it from happening. And I like to have our 3 Republicans say no, but we certainly have a good chance that Republicans in a lot. There's one district I think in California where 67%, I think it's in the farm area, like Fresno and that area, where 67% of the people in that congressional district was represented by a Republican. 67% of the people are on Medicaid. Whereas in New Jersey, that number is not that high, but 67%, mostly rural. I think Fresno, I don't know what's that, Imperial Valley or Central Valley or something like that, mostly farm country, rural areas.
Thanks, Congressman. It's 7:05 already. We have a few more questions I would love to get to. So let's try to race through a few more before we have to close. And with respect to our speakers for some extra time here. William in Aberdeen, Congressman, is asking for a little help understanding, as well as some other constituents, on the difference between the appropriations bill, the continuing resolution or CR that just passed, and the budget reconciliation process. Are these the same thing? Are they different? Can you kind of walk constituents through that?
I'll try to be brief rather than talking for an hour. The basic budget, it's different than the state. The basic budget, or the spending bill for the year, right, which is what you hear about on the state level, that was what was voted on last week. In other words, we had appropriated the money for the first half of the year, which is the fiscal year goes from October to October, but we hadn't appropriated for the second half, right, from April to October. So that was the annual spending bill. It doesn't, Medicaid is not impacted by that, but other health programs were, right? So what the Republicans voted on was to continue funding for the rest of the fiscal year for the next 6 months. But in many of the health care areas, they cut back. It wasn't just to continue the same level of funding. Let me give you an example. So for community health centers, right? They went back to March of 24, right? They didn't use this fiscal year to continue. They went back to the previous year. So it was a cut. So many healthcare programs, whether they were community health centers, diabetes programs, teaching health programs, again, I could spend all night here, were literally cut because they didn't use the last 6 months, but they used the year before as their baseline, right? But even if you were just continuing for the rest of the year, remember, this goes back to the previous year to begin with, right? So usually what happens is that in this spending bill, you will have to increase funding to keep up with inflation. So this was not keeping up with inflation, and in many cases it was going back a year before. And so there was significant cuts to a lot of health programs, but it's not what we're talking about tonight. Tonight, we're talking about a 10-year program called the Budget Reconciliation, which is an opportunity to make major cuts, or whether it's tax cuts for the billionaires or it's cuts in Medicaid over a 10-year period that is over and above what we do on an annual basis. I mean, I don't know if I'm making it less confusing or more, but that's the best way for me to explain it.
Art in Metuchen wants to know, are the cuts inevitable? Are these coming no matter what?
No, I mean, look, basically these are being done to finance tax cuts for very wealthy people. I say billionaires or large corporations. This tax bill was adopted by the Republicans when a few years ago, when Trump was president in his first term, and the Republican Congress was all Republican, and they expire at the end of 2025. And so what they're saying is we want to continue these tax cuts for corporate interests and for the very wealthy for another 10 years. And that's why they have to have, like, in other words, one of the committees, the Ways and Means Committee, and which is the one that does tax cuts, has been instructed to do tax cuts, right? We've been instructed to do cuts in our programs, which is mostly Medicaid, but that's how they're paying for it. So you could let these tax cuts expire at the end of 2025, or you could go back and do a middle class tax cut, that would help people. The average American probably costs a lot less, right? You could do all kinds of things with your tax code. You don't have to just make all these big tax cuts for the wealthy and for big corporate interests. That's what the Republicans are about.
Thanks. Let's do two more questions and then we got to wrap since we're already on borrowed time here. Janice in Neptune City is asking about ways to stabilize or better finance Medicaid. She raised the idea, which has been talked about for Medicare, of lifting the income tax cap what we pay into Medicare. Could something similar be done to Medicaid? Is there a way or a need to improve Medicaid finances? That's from Janice in Neptune City.
Well, you could, but Janice, I think that I know you're asking about Medicaid and Medicare, but I really would like to answer this with regard to Medicare, because Medicaid for the most part is being paid, Medicaid is for the most part being paid with what we call general tax revenue. And so that's why it impacts the tax code, right? But what you could do with Medicare is you could increase the FICA. What is that? FICA? Oh my God, I'm gonna sound like such a bureaucrat here. You pay for Medicare and Social Security through your FICA, F-I-C-A, whatever that stands for, as part of your payroll tax, right? And right now, there's a cap on how high, above a certain income, you don't pay it anymore. I don't know what that income level is. I think it might be, I don't know, like, I don't know what it is. Oh, Kendall is telling me here that does it tell you what the cap is? Well, whatever, there's a cap. If you make over a certain amount, payroll tax now, then you don't pay your FICA tax and you're not contributing any more into paying for Medicare or Social Security. You could lift that up and you'd have a lot more money available for Medicare and Social Security, right? Which we need because, you know, we want those programs to continue to be viable. What was the other thing I was going to mention? Oh, the other thing you could do, which would impact Medicaid, is you could have a long-term care program within Medicare so that rather than just pay for the first month of nursing home care or institutional care, it could pay for the whole thing. Now that is a lot more expensive, but I've advocated it, and you probably couldn't do it just by lifting the cap on your FICA, but you could do it rather than right now. You know, you could come up with another funding source. So I've said, well, why don't, you know, let's do a tax on corporations and let's put it some other way of financing long-term care for nursing homes so people don't have to spend down their assets in order to pay for nursing home care before they're eligible for Medicaid. Remember, I mentioned that in the beginning, that after the first month, you only go Medicare in a nursing home. You don't automatically go on Medicaid. You have to spend down your assets. And I mean, a lot of people have spent their whole life, you know, building up their assets. It also affects your Social Security. And I mean, I don't know, you know, maybe I'm old fashioned, but, you know, a lot, you know, I remember when my father would always say to me, you know, you have to leave something for your children, right? Now, maybe people don't think that anymore because they can't do it anymore. But, you know, a lot of these people don't want to have to spend down all their assets and just, you know, be completely destitute so they can go on Medicaid to pay for nursing home care. I don't think it's a good way to operate. And I have so many people that come to our office and say, how, you know, somebody mentioned planning, you know, they try to get around it by, you know, giving their assets to their children like 3 or 4 years in advance or whatever. You know, that's not a good thing either. The whole spend down is just a terrible way to operate. And other countries don't do this. You know, why are we doing this to our elderly that they have to spend down all their assets before they can go on Medicaid? I just don't like it. Now, some people may say, well, that's fine, Congressman, I don't have a problem with it. But believe me, when you get to that point where you have to do that spend down, it's an awful thing. I mean, I can't even explain it from a value point of view. It's an awful thing.
Thanks,
Anyway, I've talked
Congressman.
enough.
Dan from Woodbridge and many others are saying this has been super informative and sharing their appreciation. Anyone who didn't know the impact that these cuts would have on children, on the elderly, on working families certainly does now, thanks to the views and the stories and the experiences the 5 of you have just shared. Congressman, we're going to give the last question to Luke, who works at the Alliance Center for Independence in Edison, and he's asking for some advice. How do we convince Republicans to vote the right way here? And Luke is describing that there's a disconnect, that they don't seem to be listening to their constituents. So share some advice and then wrap us up and close down our program for the night.
Well, I would say two things. First of all, you have to make them understand that if this budget resolution is adopted by the Senate, which I think is likely, um, that they're going to be forced to make choices, and they should not make the choice of cutting Medicaid. I think there's a disconnect, if you will, between the House leadership, Republican leaderships in the majority, and the rank and file. The rank and file, more and more because of what we're doing tonight, understand that these Medicaid cuts may actually happen and they may have to vote for them, and they don't really want to. And so I think that, the more we explain that this is likely to happen, this is not pie in the sky, this is not going to go away, you're going to have to make a choice. The choice is no, we're not voting for this. I think that's the most important thing you can do. And that goes back to what Lauren in particular was talking about, which is, get out there, send the letters, have people call the three Republicans, or at least bring up the heat, on social media, that this is real. This is not pie in the sky. All right. I think that's really what we're trying to do tonight. And I guess I want to thank all of the, I say women because you're all women, thank all the women who participated in this, because I think you really did tell the story well. And thank you for the people that asked questions. Now, if you have any additional questions or comments, the last thing I will say is that, we have our website, right, which is pallone.house.gov, G-O-V, that's pallone.house.gov. And so you can follow up with us on the website with additional questions or comments. Well, if you're on the website, I'll tell you how to do it. So I'm not going to tell you how to do it. But let me thank Liam also and all of you ladies for doing this tonight. It was very informative, and thank all our constituents as well. Thank you again. Take care.
Thank you.